Hey everyone, welcome to another episode of Ask Dr. J. And one of the objections or hesitations that I get in the chair quite a bit is how much exposure am I going to receive from dental x-rays or scans, whether it be having dental implants or treatment or hygiene checks? How much exposure am I going to get? So let's go ahead and take a closer look at that. So in the medical and dental community, we practice something called ALARA, and that's spelled A-L-A-R-A, and it stands for as low as reasonably achievable. So what's that mean? Anytime that we're looking at a patient, we want to make sure that there's actually a good reason to be taking an x-ray or an image. We want to make sure that the benefit outweighs the risk and that we're not just taking x-rays for the sake of taking them. And there's multiple factors that we look at also. We look at time, distance, and shielding. So time, how frequently are you getting x-rays? That means, are you going to multiple different doctors, having mammograms, having CT scans, dental x-rays? The next thing is distance. How close is the actual emission of the radiation or the x-ray to the person? That makes a difference. And the third thing, which is really important, is shielding. Sometimes it's important that we use a shield, and there's some x-rays that the shield actually is not necessary or in fact not good. So it's really important, again, that when we're looking at this, there's no cookie cutter way to say that x-rays are good, they're not. It's patient specific, and it's specific to you and your actual medical conditions and what's going on in your life. Okay, having just said that, let's talk about some specific situations where patient scenarios may dictate different types of radiation exposure. Someone that's pregnant, obviously we want to make sure that we are minimizing exposure, and sometimes we'll do double shielding if necessary. And it's been shown that a single dental x-ray has such a small amount of radiation that if the mother has a risk of a dental infection or something that can spread and cause more harm, it's more important to get that image than to be exposed to a single x-ray to diagnose properly and get proper treatment. And by the way, dental treatment during pregnancy is typically done in the second trimester. Age. So age on the other side, meaning when someone's younger, we really want to minimize radiation because the cells in the body are dividing, someone is growing, and so less radiation is good because as those cells are dividing and maturing, we want to minimize exposure at that point. And then health conditions. And what do I mean by that? If you're someone that is going through radiation therapy for cancer, or you've had maybe a couple mammograms to diagnose possibly breast cancer, or multiple CT scans for head and neck, then we might want to minimize or reduce dental x-rays. And that's following those principles that we spoke of. So I want to go ahead and talk about exposure and some different things and how much they expose you to on a daily basis and how they compare to dental x-rays. So first, let's talk about a single dental x-ray. A single x-ray that you have taken to maybe diagnose if you have abscess is equivalent to about 2 to 3 hours of natural exposure. That means just walking around every day and living. So single x-ray, about 2 to 3 hours of natural everyday exposure. A full set of x-rays, like when you come in and you get a full set, or we call it FMX, you may have heard that in the dental office. That is equivalent to flying across the country in the United States. So maybe from New York to Seattle, I just went DC to LA. So that type of trip. And that's going to be about equivalent to one full set of x-rays or 16 to 18 images. So this is where it gets really interesting. We use a lot of what's called a dental CBCT scan. So it's a three-dimensional scan specific for dentistry that shows us what we need to see teeth, bone, and we do a lot of planning with it. So if you have a medical grade CT scan of your head and neck, which some doctors still use, a dental CBCT scan is only 3% the amount of radiation of a CT scan of your head and neck. Only 3%, a drastic difference. And this is what we use in our office, is a 3D CBCT scan. Even more astonishing, if you have a scan of your stomach for some reason in the hospital, that is 200 times more exposure than getting a full CBCT scan your jaws, so that we can do what we need to do. Some really interesting numbers, right? Another one that is kind of interesting is that you would have to have 40 full sets of x-rays to have the same amount of exposure that you get in a full year, basically outdoors, living your normal life. Now, this is obviously in ranges because some people are outdoor more, You do get exposure inside. There's more if you're outside. And keep this in mind that these are ranges, but these all come from the machines, the numbers, and the studies. So take a look at all these things and see that the dental x-ray really is not that high in comparison to other things. And it's really important that if you are recommended to get one for a specific reason, that you think about doing it, especially if you're going to risk an infection, losing a tooth, or having an infection spread to other parts of your body. So some things to consider when given a recommendation to get a set of x-rays or a CBCT scan or an x-ray to check a tooth is your specific situation. And let me explain. If I have a patient that comes in for their hygiene check and they come in every 6 months, they don't ever get cavities, maybe they're in their 30s or 40s, never had a cavity, have no bone loss, we can possibly push their x-rays out, maybe even 2 years for checkup x-rays. And the American Dental Association, or ADA, recommends typically every year to 18 months. So we can push that along a little further. On the other side of the spectrum, if you're someone that every time you come into the dentist, something new is happening and there's lots of changes because maybe you're just more genetically prone to dental disease, you should probably get them on that regular recall basis, because I'll tell you why. If you miss it, when you come back in 12 months or 18 months, you may have, instead of a small cavity, a root canal, a crown, or possibly you may need to have an implant. So getting those x-rays really matters. So some other things to consider is making sure that you speak with your health professional about what's going on. So for instance, if you just had a mammogram and you're in for your dental visit, maybe you're low risk, you haven't had a cavity, maybe you ask, is it possible, doc, if I can push these x-rays out next time for that spacing part we talked about in ALARA principles? And maybe they say, you know, we can push it out, but there's one tooth I want to check. So now there's a compromise to reduce the exposure and still get the benefit you need to check what's going on. So making sure that you communicate, and I've talked about this in other videos, talking with your physician, your dentist, your dental provider about what's happening in your life is so important, not just for implants, surgery, sedation, but for x-rays too. So I know I gave a lot of information, but here's the big takeaway. The risk from taking dental x-rays is low. The actual exposure from dental x-rays is low, whether it's a single x-ray or one of the new CBCTs that we use on a regular basis. However, if you're one of those patients that falls into those categories that we talked about, make sure that you have a good conversation with your dental provider. Make sure the office is practicing ALARA or as low as reasonably achievable for dental x-rays. So again, hopefully this was helpful. Go ahead and like and subscribe and share this information if it was helpful for somebody else, if they can use it. Again, thanks for watching Ask Dr. J.